in this beautiful city of Kisoro. I think you're soon becoming a city, right? And when I was last here, it was not looking like this. A lot has happened. I enjoyed the view as I came down. I call it coming down, but that's where we were climbing. The journey to this place was beautiful. RDC, we want to thank you for opening your door to Lions in Uganda. And I hope by the time we go, you'll be smiling along with us to join us. Lions, we are an international association of men and women who come together and simply say, let us help those who are not as fortunate as us. So where we see a need, they say there's a lion to come in and support that community. And we want to thank Lions of Kisoro that since you got established here, we are seeing you doing quite a lot. And today my visit is to check on the club, to check on what they are doing. They are, of course, will not yet start to talk. So this is like the beginning of the journey in Kisoro and to experience what the club is doing in the community. We touch environment, we do reach out and feed the hungry, we do vision, screening and many other activities. We do diabetes, we encourage good health among the people in our community. We also have programs that support the youth to help them develop into future citizens who are able to go through these tough experiences, to be resilient with the situations that we have. We are going to be sharing quite a lot, and I extend an invitation that you could find out where they meet and you join us when RDC, because Lions only support what the government is doing, and we come in with our own small resources, because we get funding from Lions International, but it is what we put in that comes back to us to help the communities where there is a big need which we can't handle as individuals. The more we are, the better we can serve. So we are on a mission to grow also, and I believe that Kisoro has some members who will be joining them so that their work can be easy in the community. So when I did only 1 year, after the end of the year, you hand over cheerfully, and another person takes over. So this year, our theme is this: kindness is a virtue. Let us cheerfully serve our community. And my name is there. So I want to thank you and really call on you, not just you, but also once you get to understand our values, our interventions, you call on your colleagues. You know, we can even form a specialty club, office-based, and you form your own club here, or you call on friends and join the Lions Club of Kisoro, so that we can be able to serve our people better. Thank you.
Thank you. The work and the compassion they have for our people. Actually, when we see such organized organizations as government, feel happy. And why we feel happy, you bridge the gap which would have been done by government, then on behalf of government. And I wish to thank also our government, which is very cooperative. You see, if our government was not cooperative, we wouldn't allow all these organizations. But because of need, we need each other. You complement, you support. As you've said that there are so many areas you touch, environment, feeding the hunger. Even at times, I have
this area where we belong. Lions who are here, the media, ladies and gentlemen, this is a quite rare opportunity for us, Lions of Kisoro, to host our district governor, who heads the whole country. And she visits a club once a year. So this is quite a special day for us. We are very excited. Madam Governor, you are very welcome.
Yeah.
And we find
Because of the neglected eye work in Uganda, there was a doctor called Dr. Longa of Mbarara University. I think he did research and he found out that there were many patients who are not accessing eye services because of many things. One, because of what you call financial barrier or even transport and the fear of going to Mbarara that time. So what they did, because he's a lion also, him and the lioness, they made a program. He requested for funds from lioness, give him money, and they are partnering with Mutolere Hospital. Yes, that's the lioness. So here, they started coming about 5 years ago. And they were giving free services. We were going for outreaches. We went to Muramba one time. We went to Nyarusiza another time. And the program was 3 years, which ended about a year also. But now, for continuity, Mutolere Hospital invites the ophthalmologists from Mbarara and at times from Mengo to come here for operations. But because the operations are very expensive, here we subsidize. We charge 300,000 per eye. But even then, many patients cannot access us because they have no money. So I am requesting kindly the government or the district to employ an ophthalmologist who will be doing the operations here because it becomes cheaper for us. As for those who come from Mbarara and Mengo, the hospital pays them allowance, transport and accommodation, which all that money should come or comes from the patients. Certificate. I thought I was not doing much. Then I went for the diploma. Still that one was not much. Then I went for another diploma in the operations. That diploma for operations of the eyes, I did it in the Kilimanjaro Medical Mission Center in Tanzania. Then later on, I went for a refraction course. I know how I can make spectacles. For the refraction course, I did it in Nairobi. So after that, I came here and started working. But for continuity, I decided to train few students, few people who wanted to do ophthalmology. Like in Kisoro, there are 2 OCOs in Kisoro Hospital. Here in Mutolere, there are 2 ophthalmic assistants and 1 ophthalmic nurse, ophthalmic theater nurse. That's one for continuity. And still for more continuity, I sent somebody to Mbarara University who is doing ophthalmology, a master's degree in ophthalmology. They call it Master of Medicine ophthalmology. So that when he finishes, he will take over and will no longer be bothering people from Mbarara. Yes.
of Kisoro, which is a usual routine visit for every DG to reach out to the clubs. And the Kisoro Lions have been able to take me around. I met the administration, the cow, and the town clerk, and it is so exciting to know that also the government bodies are supporting the Lions' work. Our duty is to serve where there is need. And I'm so excited to know that even the contributions that our Lions Clubs International have made to this region have been put to use. When we visited Mutolere, the hospital, we found the eye screening going on, which is beautiful to know that they have even a resident ophthalmologist to carry out this work. You know, it is one thing to donate something, and it is another to find that it's being put to use. So as Lions of Uganda, we are so happy to find out that the little we contribute is helping our community members. And this area where we've met at Potter's Village, I'm seeing so much need. It is so amazing to see the work that people in this place are doing with these young children. My call to the public is to continue to support such centers so that they can be able to do more, and also to call on more people to join Lions clubs so that we can do service together and reach out and make more impact in our communities. It is a blessing that I'm in Kisoro today, and the experience is great. I thank you.
Yes, basically the abandoned babies, we get them from town, from police. Anybody who gets an abandoned baby, they'll get in touch with us and they just bring the babies here. Then we also receive babies whose mothers died during birth, and after that one constitutes the biggest number of babies we get. Either during birth or shortly or any time like below 6 months. And you know this family cannot be able to look after this baby, so we receive those ones. And we also receive children whose mothers are mentally sick. As times we discover this mother can be a harm to the baby herself, so they bring those babies to us. And when they come here, we give all the care. The family doesn't pay any money at all, but what we require from the family, in case the mother dies and we know the family, what we require basically is to keep in touch with this family. At least twice in a month, they should come and visit the babies, because we don't want them to lose touch. At some point, we have to take back the baby to the community, so we want the family to keep in touch with us. So we keep the babies here, maximum is 2 years. But in most cases, we don't reach 2 years because there will be too many and we can't have space for them. So when a baby is around 8 months, 1 year, and they are very healthy, they can feed very well, we work with the family and take back this child. And we do it because we do not have enough space, but we also want to encourage this bonding between the child and the family early enough. We don't want them to look like we are institution children. So that's why we will settle them back to the community when it is still early. But even then, when they go to the community, we don't stop there. Definitely, when a baby comes from here, normally we are taking them back to the grandmothers who are very old. And at times, they are not able to do the feeding that we desire or what the child was used to. And at times, they do not even have the food. So we keep those children in our support, and we require them every month, bring the child for monitoring. And when they come for monitoring, we also give out food or money and other basic things to use in the family. So until we are sure this child has settled very well in the community and in the family, that's when we say we can stop there. So I cannot tell the exact age we leave this child. It depends on the family the baby has gone to. It depends on the health of the baby. So many factors. Because normally we reach 5 years, but right now we even have children who are 14 years and they are still in our care. So depending on the family, where the child is going, how the child is doing well, we keep them here. So I think the rest we shall discuss as we go.
I just want to know one